Hey everyone, welcome to another episode of Darshan Talks. I'm your host, Darshan Kulkarni. This is the second episode we're doing today, so if anyone's listening in, you're going to get some really interesting conversations again because we're going to be focusing on content management today. It's my mission to help patients trust the products they depend on, but to help patients trust the products, they have to hear about them and hear about information that will be helpful to patients. I'm an attorney, I'm a pharmacist. I advise companies with FDA regulated products. So if you have an interest in an FDA regulated company or its products, this is the podcast for you. Today's podcast is about content management. It's about how do you choose channels. If you are in medical affairs and are trying to figure out how best to reach physicians, if you are in sales and you're trying to figure out how best to reach physicians, if you are in marketing or an MSL, these questions are going to be very important to you. So you should care about this. You should hear about this and ask questions. Today's guest is really interesting. He is the digital and multi-channel strategy leader, and he's actually leading it for AbbVie Brazil. So what we have is an international flavor. We have someone who understands content not just from a US centric viewpoint, but while he understands the US, he actually is also speaking from the Brazilian viewpoint as well. We do have to clarify just to make sure if you're looking at the bottom, these opinions do not necessarily reflect the opinions of Douglas, of myself, or our employers. In my case, my employer is my law firm. But in Douglas's case, it does not reflect the opinions of AbbVie. So, ladies and gentlemen, our guest for today, Douglas Camargo. Douglas, thank you so much for coming on.
Thank you. Thank you for the invite. I'm really excited to share a little bit about what we have been done, and thanks for having me here.
Of course. So, Douglas, let's start with a really basic question. Everyone's talking about content management, and everyone's talking about how content management is king. And you had a really great line. If content management is king, who is the queen of content management?
It's a very good question.
Yeah.
It's a very good question because everything ever knows the amount of content we have been generating through the past year. So since last year that the world entering the pandemic mood, we change everything. We are transforming all the business to work in a digital space. So everything that we had before now, it's digital. And once you have digital, you have a lot of opportunities, a lot of possibilities. And when we use the content as the king, we needed to understand that the communication of this content is the queen. So how you can use all the valuable content that you have and in which way you communicate that to use all the potential of your content has and how you can deliver this to your audience. So these are the big question for this year, maybe, because everyone knows the challenge to attract attention. When we talk about to attract attention, the time that we have, it's day by day a little bit more difficult to use and to allocate. So when I'm thinking in a strategy to deliver my content, I needed to think better in which way I'm delivering this content and how I can communicate this better to reach my audience and to make they understand the point of view of this or the value of this. Because in a world with a lot of information, it's very, very easy to get you lost, to get you out of the track. And then when you prepare a lot of contents in a linear way, you needed to understand the steps you needed to follow to communicate better, to deliver this content better, and then to reach this audience, and the audience being so empathic with your content that they can came back in another moment because they know that there they can find what they are looking for. So this is maybe our queen today, how we can treat the communication line.
So you talk about if content is king, communication is queen. And some might argue queen is even more important than the king, because it's not just what you say, it's how you say it. So which raises the question, in today's environment where you've got situations where you've got so many different forums you can engage. You've got your Facebook, you've got your LinkedIn, you've got your Instagram and Snapchat, et cetera, et cetera, et cetera. How do you decide? If communication is queen, you've got to understand who you're communicating with. So who do you define as your audience? Is it patients? Because in the end, patients have to take it. Is it healthcare providers? Because they're the ones who prescribe. Or I don't know the situation in Brazil, but in the US, we also have to consider payers, who are the ones who will pay for it. So how do you decide where you have to reach the customer? And then how do you decide what the right forum is?
Yeah. So the first step is to know deeper the channels that you are using. So if you go to a social media, you need to understand the difference between them. So when we enter into Twitter, it's a social network. It's pure text. We also have like videos, we also have images and etc. etc. But the conversation in text there is the biggest value that you can bring from the social network. So how your content will communicate in a text message or in a text format. So you need it to be short, you need it to be very objective, very clear, and then you can use like a short link to redirect your audience from that post to your main content, so they can go deeper there and understand better what you are saying, or consuming the entire content that you prepared for them. If you look for the Instagram, you also have this kind of mix of text and image, but Instagram, it's exploding possibilities now because you have a lot of functionalities then into this network. You can reach them by stories, you can reach them by IGTV, you can reach them by Reels, and every style of this content, every format of this content have their own way to communicate. So if you think that a single post in an Instagram, you can use image or a video, because the feed post you can use both, and behind of that you have the subtitle or the legend. I don't know how you say it there, but you always see that you have a support text. So when you use this format, you need to understand the proposal of this. So understanding the format for each social network, you can start to define your audience based on the format and the social network that you are. You must know about the audience, the people that you consume your content there, and then you started to design a strategy to use the content in the right format to reach the right people, and most important, in the right time.
See, I find that to be fascinating, because I've always heard you go the other way. You first find the audience and then figure out which format they use to reach out to.
Yeah.
But what I hear you saying is, that's great, but you can make the format work for you anyways. So,
exactly.
So what I'm hearing you say, and please correct me if I'm wrong, but if you choose, say, Instagram, and you talked about Instagram, the usual Instagram feed, you can talk about stories, you can talk about IGTV, you can talk about Reels. Is it better to invest into a single format first and use all the different possibilities? Or is it better to be a little bit in every format?
I may say that we have a different approach here.
Okay.
When you look at the stories format, stories, it's very useful to engage with your audience. So you have your base of followers and you use stories to engage with them, to show pieces of content and to bring their attention to your brand or to your channel. In the feed format, you use that to reach more people. So you can promote that and you can go outside of your followers and reach other people that are not familiar with your content or doesn't know you yet. When you use Reels, you are using like a more entertainment content. So you are there more to make them feel better than to communicate something deeper. And when you use the IGTV, you can like start a live exactly in the same way that we are doing here. And then after you complete this live, you can post it as a IGTV to keep this live available for people that doesn't have the opportunity to follow your session. In these three different ways, you see that before I know my audience, I know the formats that I can use, and I know the proposal of the tool that I will post this kind of content. So if I want to reach, I use feed. If I want to engage, I use stories. If I want to go deeper in the content, I can use IGTV following a live session.
That's brilliant. I'd never heard of that before. That's amazing. So if I am a medical affairs group, right? So what Douglas, as I hear it, you're more in the marketing space. You're more trying to say, how do we get marketing to reach out from a sales perspective? If I'm in medical affairs, I'm not selling, but I still want my physicians to understand the science. And this could still be a forum or format to go, you know what, I want to use stories to tell the story of, say, a certain patient. If I'm using feed, I want to reach out, use the feed. I want to reach out to physicians. But do you think that certain people take different formats differently? And I'll tell you what I mean by that. I personally avoid having work friends on my Facebook feed. I don't like work friends on my Facebook feed because I find that to be too personal. But on LinkedIn, I want my work friends there, and I don't really want my personal friends on my LinkedIn group. Is that, if you plan your strategy the way you're planning it, do you worry that you might mix that for the audience? Like, they're not there to hear about pharma if they are on Facebook. Like, how do you deal with that battle?
Yeah, maybe this is one of the main difference between cultures in countries. Like in Brazil, it's very common to have this mixture. So I'm following a guy that I'm inspiring by him because their professional life, but I'm also curious about their personal life. So what he's doing during the weekend, what is the place that he goes, what is the preference when he eats something or he chooses a movie or a TV series to watch. So in Brazil, it's very common to use that kind of mixing of personal life and professional life for any kind of social networks. When we go a little bit outside, we know that the other cultures are a little bit more close than this one. So if you choose to use your social channel to share only professional content, maybe you'll be seen by a very professional guy or a workaholic because you only talk about work. Here this is maybe nature from the Brazilian people. We mix that. So I can show you a little piece of my work, but I also show a little piece of my personal life. Before we started this live, I was with my son here, and we had this little chat. We have no, I don't know how to express that, but we have no like these limits to separate our professional life than our personal life, because we are the unique human being. So this does not make sense for the Brazilians to have two profiles, to talk about two subjects that are generated by the same person. So
is your Facebook account very similar to your LinkedIn account from that perspective? Like,
no, because I choose exactly the piece of content that I shared. So I'm a guy that I use more Twitter and Instagram and LinkedIn. Facebook has changed a lot of the way that you work with the social networks, because they are putting a lot of focus on the groups. And I'm not so into groups, because groups means you need to be part of a community. And sometimes I don't have time to be part of a community full time, as we see other users doing that. So Facebook, it's day by day decreasing their importance on my social presence in a network or online life, if I can mention that. So in the Instagram, I mix these two subjects. So I show a little piece of my personal and my professional life. In the LinkedIn, I'm very strictly only in my professional life, because we know the people that are there are looking at you only as a professional, so they are not into your professional life, but they can find you from the LinkedIn, they can find you on the other social networks, and then they can understand better, how is the Darshan in their offline moments, what he's doing. He's a good reader, he is a fisherman, he is I don't know, he have some hobbies. what kind of hobbies, and etc., etc. So I can understand more in a holistic view who is Darshan and why he is doing his job in the LinkedIn in that way. But he's also has a personal life, and the personal life it's also so interesting than the professional part of the Darshan that we know.
Very, very interesting. What I hear you saying is that you see them as sort of two parts of the same coin, and you get to see the person and why he or she does the things they do, and that's the benefit. Now, do you have a private account that's separate from private Facebook account that's separate from your professional Facebook account, or do you just keep one account and people can come in, bosses can see both parts of it?
Yes, I have only one because we are only one. So, and sometimes I'm more into the work, so I will talk more about my work or about some strategies that I use in my work. And sometimes I will show some pictures or some snapshots about my daily routine. So I woke up early, I have my exercises routine, and then I can post a picture about my lunch, and etc., etc. So the mixture of those moments give it to the audience a vision more complete about the person that is consuming this content. So this is very interesting because we know that it's very easy to be fake in an online environment. But if you start to show how you are independently of your professional or personal account, if you are showing both sides, the people can understand you better. And this is also brings you to a level of empathy that you never had before. So I like this way. I use this a lot because sometimes I can see that the people that engage more with the work content or the work, the professional content that I publish is one style of the people, and the other side, when I post some from my family or from my son or from my dog, etc., etc., I can see that there are other profiles. So inside my audience, I have a very good mix about this. I also have some colleagues from my work that I like some posts that I made from my professional life. But you can see that it's a small part of them that mix these two subjects. And it's very interesting to also understand the behavior of them, because they can sometimes make a comment in your professional content like, oh, you are right, this is blah, 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 blah. But in the professional life, when you post some activity photo about my son, he can post, oh, he's so handsome, it's not like you, blah, 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 blah. So this exchanging of conversations or this exchange of experiences, actually, it's making the social network so interesting to work on. And then when we start to discover how this works, and to do that, you needed to also know a little bit about how the algorithms works behind of the social networks. It's easy to understand from the content, from the strategy, from the format, and then what is the audience that I reach.
So you talk about how you allow, at least in the Brazilian culture, you allow people to intermingle their lives. One of the problems we've had in the US is that people, when they're being hired for jobs, they have to deal with the issue of, you know what, I said something silly when I was 18 on my Facebook feed, and now it's there forever. But if I can control who can see my Facebook feed, then I can control the damage that I can cause. So we tend to be a little bit more gun shy about that. Has that been a problem in Brazil or not so much?
Yeah, for sure, for sure. We have a lot of cases here that someone posted something maybe was not so elegant, and when the company knows about the opinion that he made, he needed to suffer the consequences. About maybe he lost his job or received some letter from the company saying, "Oh, this is not the behavior that we are expecting from you as part of our company." So when you know that you have only one profile and you are using this for both proposals, you need to be aware that you need to pay more attention about what you are sharing. So even if you are sharing a post from other profiles, so this is how the people you see you. So if you want to be a person that talks about all the subjects without any filter, okay, this is your decision. But knows that maybe sometimes when you talk a lot about something that will be not so political from your side or not so polite, you may suffer some consequence that you can imagine. So take it easy. Do not go in the subject that you are not so familiar, and
Right.
and try to not speak aloud in a social network something that you can't speak aloud in your table with your family, because the
Yeah.
consequences sometimes are hard.
So so now let's say you're trying to reach out to physicians. You're trying to make them understand more about what your product does or what your company does. They're more comfortable because you can understand both sides of them. Um, so how do you then take them from you're a physician who interacts with my content to I want to bring you into my community? And how do you sort of build a community around these physicians? Do people balk or do people struggle against the idea of leaving well-established channels to join another channel?
Yeah. It's one of the best part of my work, because when we are trying to do that, we're working with the behavior of the people. So you need to understand, you need to know more about people than the marketing or the strategy or digital or any other stuffs, because the behavior of them will drive you to the right strategy to attract them and to maybe convince them that they can be part of a community to discuss the therapies or the specialty that they are working on. So, specifically on we talk about the physicians. The physicians are very not concerned, but they are very limited with the space they give to the pharma industry to reach out them, because they know that behind of those speeches about all our products, etc., etc., they are all the pharma companies are doing that only to try to selling more.
Yeah,
This is natural, okay?
yeah,
The market is for this. So, but when you have another proposal, so in everything we have our mantra, make a significant impact on people's life. When we started to look at this side of the coin, and you understand that I needed to generate a so valuable content that whatever is the intention of a prescribing or not, a group of physicians will be interested about this content and they will come back here to consuming more. So the strategy to build the content, it's always looking, this content is good enough to make a significant impact in the people's life. If
yeah,
it's not, we take it out and we build other, or we make other. And then now we have a collection of a very good content that we believe that they can make a significant impact in the people's life. And then
yeah,
when you start to create content with that mindset, the game changes. You see that the people that are coming to read your post or to watch your video that you produced with that mindset, they are more engaged with you, they are more empathy with you, they understand behind of those letters what you are really asking them to do. That's to also make a significant impact on their patients. And
yeah,
then you started to align all the proposals. Me as a company, I'm producing a content to convince my audience, and my audience is the physicians, the payers, the patients, to make a significant impact on their lives, and then they can have a better quality of life. They can have better access to treatment. They can maybe return in the life that they had before they got some disease or whatever. And then this facilitate a little bit the strategy to deliver that to our audience. So I have a content strategy focused on my patients, focused on my payers, focused on my physicians, but with this mindset always presented in our sessions that we are creating content, makes easier to not only understand the impact that we are making, but also that it can be replicated for other audience that I can reach, because they are not close to my environment, to the space that I can act. And then we have the other players that can replicate that message, and we can go further.
but what I'm hearing you talk about, and please again correct me if I'm wrong, but you're talking about having a good content strategy, and the content strategy is what brings people to the table.
Mm-hmm.
But one of the conversations we had with that was they're engaging all these different formats, but what you might really want is to provide a safe space for physicians to communicate with each other and build a community that, again, I'm not speaking for AbbVie, but a group like AbbVie can support, saying, let's say let's say you have a Alzheimer's drug. I don't know why, but let's say you had an Alzheimer's drug. You would then create a community of Alzheimer's treating physicians that they can come to and consume the content. But it feels like content is only part of the equation in building a community. So what are the other components of community building?
Trust is the first one. So you need to trust in that environment, that you can feel that you are part of something more, so you are not there alone. And the content the content works better when you can link to professionals. So I am a kind of professional, and I have some understanding about this concept. But with this content, I can expand a little bit my mind, and I can understand the other side. And then on the other side, I have another professional there that has exactly the opposite opinion that I had before. So we can interact each other. We can understand this new concept together, and then maybe we can also replicate that new concept to other colleagues. So you can talk about a new treatment. We can share like a case of a patient that needs some support that they don't know how to manage that, because this is never happened. And then when start to sharing their experience, because they trust in the environment that they are, everything goes smoother. Everything goes more easy, because the main proposal of that is to exchange experiences. So the content is just the first part of the action. I posted something there. So with this post or a video, they can learn something. And with the learning, they can also start to apply what they learned right away. And then they start to see that, oh, this really works. Or before I started to apply my new concept that I learned today, I will share my opinion with other colleagues that are also there. And then we can maybe understand better if this is the right way to go, or this is the solution for some problem, or if we agree that yes, we are comfortable to start to apply this new procedure, and maybe we can save some lives, or we can shorten the patient journey and make them suffer less. They are suffering more without this new procedure. So the possibilities are infinite. We are talking about changing patients' life, or changing a doctor's lives. And then when you can do that with your content, because of that, the strategy of the content is very, very important. When you can do this with the content that you are providing, whatever is the audience that we mentioned, you see that naturally this started to being shared, it started to being applied, it started to being reflected on the people's life.
So you said a really important thing, and you discussed it a lot, and you talked about the value of trust in building a community. How do you get that trust?
Make them understand that this is their space, so they can talk about whatever they want, because the pharma market, it's a very regulated market. So you need to be very concerned about everything that you are speaking, or you are mentioning, or you are doing, because sometimes you not have all the possibilities to explain or to share what you have. This is a particularly aspects of the market. When you build a community and you make the people that are part of this community feel comfortable to share experience there with other professionals, because they are in the same situation, they have the same case, they have the same, I don't know, the same patients to be treated, you make them to naturally understand that there they can go there, they can speak with other colleagues, they can maybe speak with some opinion leaders from the market and share with them or ask them some questions like, oh, I have a situation here and I don't know how to deal with that. If it was me, what you can do, or what are the possibilities that we can do? So they are sharing, they are building this community, they are trusting each other to make that environment their own environment. This is not from pharma, this is for them. So they needed to be comfortable to do that there. And with the comfortable, they also can starting to trust more. And once they trust more, this is the fuel that we need. With trust and with comfortable with the usage of that environment, they can go as far as we can imagine it.
But now here's the problem. When you have trust, especially in a pharma regulated company space, you have to then necessarily look at controls. And what I mean by that is people can't talk off label. People, if you do talk off label, you may have to redact that content or respond to that content or whatever it is. Will that censorship erode trust? How do you balance that desire for open communication with the laws that prevent you from allowing such conversations on that forum?
It's a very good question. But if you look in other space that they are doing that, they are always talking about whatever they want. So it's very difficult to control all the people. So not only the physician, not only from medical side, but in everything, in every subject. I did I studied in Clubhouse, understanding what brings so many doctors there to discuss what they want, because they are not regulated there, because what they are talking there, it stays there. And then they are also learning more, they are evolving as a professional, they are hearing from like people that has more experience than they, and they are moving the needle to have another level of understanding about how I needed to deal with the situation. And this works very, very well. The people are always talking about everything. But when we, as a pharma company, are creating a community for that, we needed to pay attention on this. We have a lot of these disclaimers to make them aware that, look, your opinion is your opinion. Please use it with carefully, use it as smart as possible, and do not cross the boundaries that you not cross it outside of this community, because we know that sometimes a little piece of information that was communicated wrong can be a disaster in the long term.
Yeah.
So we have this kind of not educational professional, because we are not there to educate them, but we are there to also guide them. So you know that what you are doing is off label, you are not allowed to do that or something similar. Please take this subject with very, 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 very careful, because and sometimes this can be used for one situation, but it can be applied for all the situations. So pay attention and be responsible about your opinions. Maybe this is one of the strongest message. If you are responsible about your message, if you are responsible about your opinion, that this has changed everything, because you know that you can be responsibilized because this is right. Sorry, but maybe you can be appointed as the responsible of that message, and then you will suffer the consequences.
That's such a great high note to leave on. Quick question for you, Douglas. What is one question you would ask the audience to answer for you?
How you guys are also dealing with this amount of information that we have there, and how you are maybe redirecting them to your proposal.
Explain that question to me. I don't think I fully understand. How do you handle the amount of information?
Yes. We have a lot of information now, but how you are using that for your proposal, for your objectives. You see, because you can stay like weeks watching only TV series, but what you're learning there and how you can use that, maybe a little piece of this, but in a broader way, when you have a lot of more content, how you're using all that content that you are consuming in your proposal, in your daily routine, how this can making you a better person than yesterday.
Oh, I love it. How is the content you're consuming making you a better person?
Yeah.
I love it. I do want to do a quick summary of our conversation, Douglas. We
Mhm.
spoke about content. We talked about the new formats that are out there and how you choose the formats. I love the conversation we got into on just discussing Instagram. We talked about engaging with using stories, reaching out using the feed, entertainment using reels, and then live IGTV, which is live and keeps them there.
Yeah.
We talked about Twitter text. We talked about Instagram and how that differs. We then spoke a little bit about content being king, but communication being queen, and the value and importance of that. We then talked a little bit about building communities and went into the issue of trust and spoke a little bit more about how do you build trust. We talked a little bit about how do you enable companies to enable healthcare providers, choosing your audience, and how all of that comes together in community building. Did I miss anything?
No, I don't think so. I just would like to highlight that I really like the link that we did when we start talking about our personal lives or our personal profiles and how
Yeah.
it's also reach the issue inside the community. So in both situations, you are responsible about your opinion. So take care
Excellent.
about what you're saying. Do not say anything that you don't control, and knows that maybe sometimes that something that you are saying today will reflect in a different way tomorrow.
Very cool. I'm going to ask you three rapid fire questions. Are you ready?
Yeah.
Okay. Let's see. How do you define success?
Success is something that other people see in you, but you maybe are always looking for and never knows when you reach.
Very cool. Um, how do you balance ambition with contentment?
Ambition is the fuel, and contentment baby is the time that you spend with your family after you reach all your goals.
Okay. Um, last question. What challenges you?
A big problem without a solution. So sometimes the people came to me like, "Oh, I don't know how to do that," and then sometimes I know the answer, sometimes I don't know, and this is the best part: looking for the right answer for the right problems. Because we also know that we have some problems that we are not so strong to resolve them alone. But in most of the cases, if you step ahead and think 5 minutes, you discover by yourself what is the right decision that you needed to do to make that problem solved.
Very, very cool. Where can they reach you if they have questions, Douglas?
Oh, you can use my LinkedIn profile. So my connections are opening. You can add me there. Or here. Sorry, I was a little lost, and we can interact behind here. We using the comments, so I will take a look, and I will do my best to answer all the comments. And let's see if this session will have a lot of interaction, guys, because this is how the algorithms understand that you liked it. So if you liked it, please hit the button and like this post.
Thank you. I'm agreeing with what Douglas just said. If you like this podcast, please like it. Please leave a comment. Please subscribe. Please answer Douglas's questions. You can find me on Twitter at Darshan Talks or go to our website at darshantalks.com. Thank you again, Douglas, for coming on.
Thank you too, my friend. See you.
See you.